Welcome back with Carrie and Sam inside American Healthcare. We will be talking about blood work for this video. The blood work that happens at routine wellness visits and some blood work that might happen if you're not really feeling too well.
So, we're going to talk about what each blood work is and covers. One of the comments was that somebody felt like they weren't getting a full panel when they were getting their routine exams. So we'll just tell you a little bit about the blood work that you would expect to get done at your doctor's office.
Yes. And I think an important thing to remember is that if you're coming in for a wellness visit, depending on your age, so I would safely say 25 and under usually do not get a lot of blood work routinely to check for things. At 25, you're usually pretty healthy, and if you're having an issue, you've let us know that you're having an issue, and then we can check blood work. A lot of the routine blood work is CBC. That is a complete blood count. So that is going to check your red blood cells, your white blood cells, and the components that make up each of those as well. It's not just those two.
Right.
In your blood.
So if you're coming in telling us that you're having, symptoms of an infection, that would be one of the labs that the doctor would order.
Or chronic fatigue.
Yeah.
That might
any
be
sort of anemia.
Easy bruising.
Yeah. So we would want to see what your blood counts are.
Yes.
One of the other blood works is a basic metabolic panel. This would cover your kidney function, your electrolytes, your sodium level, potassium level, and then there is also a complete metabolic panel that also includes your liver function as well. So depending on symptoms you're having or things that you're at risk for, one of those two may be ordered for.
Yes, and typically patients with hypertension, BMP is a routine lab that is done to check how your kidneys are functioning. Some of the blood pressure medications that are given can affect your electrolytes as well, so we'll check your sodium and potassium with that. Another routine most people know about is the lipid panel. This is reflective of your cholesterol, so that will check your total cholesterol, your triglycerides, your HDL, which is your good cholesterol, and your LDL, which is your bad cholesterol. This is one of the labs that you want to fast for. So when your doctor's office tells you to fast 12 hours before, water and black coffee are okay in the morning with all of your regular meds. It's so we get the most accurate reading for whether or not you are at risk for a heart attack. That's one of the things that it will tell us. And keep in mind, if you are currently on a statin medication, we will check your lipid once a year or more if we make changes or we see the medication isn't working.
Another blood work lab that is sometimes ordered is a thyroid level, or what we call a TSH. If you're on thyroid medication, we also like to check this once a year. If you're having any symptoms of, fatigue, hair loss, weight loss, weight gain. That was
heart racing, palpitations, cold or heat intolerance.
So those would be things that a TSH would be ordered for.
And if you are pregnant, your TSH will be monitored at least once through each trimester, because the levels can require more medication. Babies take everything from us. So, and then after you deliver, you have your levels checked a little bit more often for that also, to make sure that things are returning to normal or that dose adjustments don't need to happen. And a PSA. This is one for you males. Ladies, we don't get this one. So men starting at 55, it is routine for a PSA test to be done. That will show if there's an elevation in a prostate antigen. So it's prostate specific antigen.
And so what would that indicate?
So that would indicate that you could have an enlarged prostate, which, worst case scenario everybody jumps to could be prostate cancer. That is common in men, but it's not always the case. Sometimes it can be caused by other infections. If you have a first degree relative though, so let's say your husband's father was diagnosed with prostate cancer before 50, you want to tell your hubby to get checked at 40. That is when the doctor's office will start checking. Or if they're having symptoms or the doctor does a prostate exam based on symptoms and feels an enlarged prostate, they would also check a PSA.
Yeah. Another thing that we often check is an A1C, which would be, for our diabetic or pre-diabetic patients. An A1C checks your sugar levels and what they've trended over a 3-month period.
Yes.
So, the higher that number is, that tells us more of your blood sugars are daily in 200, 300 range. So we want that number to be lower. For non-diabetic patients, we want it to be less than 6.
Yes.
And for diabetic patients, we like to see under 7.
That signifies control,
Yes,
correct? That
controlled
means
blood
that your blood sugars
Yeah.
are typically under 110, 120 on average.
So, and then to go with that is we often do a urine albumin creatinine, which is a urine specimen that your doctor may ask you to go into a cup, and that just kind of checks
Your kidneys.
the kidney function.
Yeah, to see how they're functioning. Because, when you have diabetes or you're pre-diabetic, you start to show early signs of kidney or organ or vessel damage. So we want to see those numbers lower, and the higher that they are could correlate with more symptoms further down the road, not always initially.
So overall, that's basic blood work that we do, and things to ask your doctor for, and what it means. And if you ever have a question about it, call your doctor's office and ask the nurse, because we can usually. And if we don't know, we ask the doctors.
Send them a message.
Yeah. So.
And keep in mind too, if you're coming in for a sick visit, that is a whole nother story. So the things that we just discussed were related to wellness visits. So you come in once a year, which you should see your doctor once a year.
Yes.
Even if you're healthy and you're in your 20s, that helps us make sure that we're not missing something. It helps us make sure that you're on the right medications if you are on a thyroid medication, for example. But if you're not feeling good, don't hesitate to call and say, hey, I'm not really sure what's going on. Do I need some blood work? Do I need to come in? Yeah. And we can kind of go over that with the doctor and you, and get the blood work done to check for other things like autoimmune disorders.
Which we are seeing a lot more of, in the presence of the pandemic. So a lot more people are having a lot more inflammation in their body, aren't necessarily eating great, exercising like they should.
That, or they haven't come in a year and a half because COVID kind of put everything to a halt. So your routine screenings, whether blood work or your mammograms or your colonoscopies, please, people, COVID is settling down. Regardless of what you believe, vaccine or not, preventative screenings are so important to pick things up early. So please get your tatas and your booties checked.
All right. Thank you.
See you next time.
Bye.